Most people who come in with colon cancer, surgery will be the first thing that in the treatment plan for them. The surgeon will order blood tests to look for levels of the cancer in the blood. They will order a CT scan of the abdomen and pelvis, and occasionally will also order a PET CT. In patients who have colon cancer, after surgical removal of the cancer, many patients may get chemotherapy after surgery. The exception is if they have metastatic disease, meaning spread of the cancer beyond the colon to other organs such as the liver. In that setting, the first treatment may be chemotherapy. Rarely will a patient with colon cancer receive radiation therapy. In patients who are diagnosed with rectal cancer, unless it's a very early stage of rectal cancer, the treatment paradigm involves first giving them chemo combined with radiotherapy, a rest period of 8 to 12 weeks, followed by surgery. And that surgery often will include a temporary ileostomy. The big concern patients have with having an ileostomy or a colostomy is body image. And even with the new pouching systems that we have, that's still a concern for them. However, what I tell patients is that this is life-saving, and that in every profession there are people who have stoma bags. You need to know what you're doing when you're working on the rectum, because there is very little leeway for making an error. You're often working in a confined space, and there are several vital and irreplaceable organs in the area, including nerves, the bladder, urinary system, the vagina, and the uterus. So there's a lot in a very small space. When we do rectal removal for cancer, it is essential to remove the entire mesorectum, which is where the lymph nodes are located, around the rectum. And colorectal surgeons in particular are trained to do that without violating that space. Colon's a lot more forgiving because most of the colon is free within the abdomen, or easy to free up within the abdomen. Once a patient has been diagnosed, we're discussing their treatment plan with a medical oncologist, oftentimes with a radiation oncologist, with the pathologist, the radiologist, the genetic counselors, social workers oftentimes, and sometimes even the nurses that are involved in the care. Dr. Phil Gold is the leader for GI oncology in the Swedish Cancer Institute. He has clinical trials for each stage of colon cancer. He is a national expert, and he knows every study and the results of every study and the number of patients on every study, and he's really an exceptional guy. There has been an increase in targeted therapies and improvements in chemotherapy, so that even patients that 10 years ago we would have said had a 6-month survival are living for years.